Patients with COVID-19 display a high percentage of neuropsychiatric complications, including anxiety, depression, post-traumatic stress disorder, obsessive compulsive disorders, and insomnia, with anxiety being the most frequent one. We consider it timely and essential to review anxiety in COVID-19 patients and in the post-COVID-19 recovery phase. We include the literature from PubMed until the end of September 2020 and our own observations on anxiety in COVID-19 patients. Multiple biological and psychosocial factors are important for development of anxiety. We discuss these factors, which are important for identifying individuals at risk and for adapting timely measures to prevent and treat anxiety. We discuss the pathophysiological mechanisms of anxiety, which involve activation of the immune system, release of cytokines, and in the severe cases, occurrence of a cytokine storm. We present the anxiety in different patients without or with prior psychiatric illness and with other comorbidities. Anxiety is observed in asymptomatic and symptomatic COVID-19 and can be a long-term complication, particularly after development of acute respiratory distress syndrome or stay in the intensive care unit. The general guidelines for management of anxiety should follow the guidelines for management of a psychiatric illness in a disaster and/or trauma. Efforts should be focused on instilling a sense of hope and strengthening resilience. We present the main psychiatric rating scales for diagnosis of anxiety and the main treatment approaches, pharmacological and non-pharmacological. Among the anti-anxiety medications, it is important to note that some may cause cardiorespiratory side effects and therefore they should be avoided in patients with respiratory problems. In choosing an anti-anxiety medication, it is important to have in mind the patient's condition, the tolerability and the clinical efficacy of the medication, the stress response, and the immune response. The anti-anxiety medication fluvoxamine may be particularly useful because it might block the cytokine storm in COVID-19. Adjunct anti-anxiety medications, which have a beneficial effect on the immune system and have anti-inflammatory properties, are oxytocin and melatonin. It is important to follow up patients after COVID-19 for anxiety. In this respect, peripheral blood markers may be very useful indicators of the disease course. In conclusion, in this review, we provide guidelines for the management of anxiety in COVID-19.